right. First of all, I wanted to thank Dr. Hawkins, Kuklinski, and Prado for inviting me to speak. This is actually my first time at the Society for Prevention Research, and I've been eyeing this conference, so it was nice to be able to come. And I'm going to be talking about increasing the reach of evidence-based parenting interventions through two projects that I've been working on. The first one that's using community engagement or community-based participatory research, and the second is integrating a parenting intervention in primary care. I have no conflicts of interest to disclose. So the first project that I'm going to talk about, I wanted to start with it because it kind of gives you an idea of how, as a pediatrician, I even got involved with parent training. And then I'll move on to what Dr. Levy was talking about this morning about how do we move from doing these efficacy trials to actually trying to incorporate parenting interventions in primary care afterwards. So evidence-based parenting programs have been proven to prevent the onset and escalation of child mental health disorders. Yet participation rates are low, which really limit the impact at the population level. Few studies have really focused on evaluating theory-based strategies to overcome barriers to participation, especially among hard-to-reach, marginalized immigrant populations. One example of a population that is at high risk for adolescent health disparities are Filipinos. They are the largest Asian population in California and the second largest in the United States. Despite their size, they're often described as an invisible minority because of the lack of health-related, mental health-related, as well as intervention research on this population. Among the few studies that have been conducted, they point to high suicidal thoughts among Filipino adolescent girls compared to other ethnic groups that were in this particular study. In addition, Filipino teens have higher depressive symptoms, adolescent pregnancy, substance abuse as well. And so I've had the pleasure of working for the past 10 years with the Filipino community in Los Angeles to really listen and ask them what their needs are. And so I started in my faculty position at Children's LA, starting with the first circle there is asking the community, how can we prevent these adolescent risky behaviors among our youth, and is it going on in this particular community? And part of my needs assessment, a Filipino psychiatrist actually recommended that I look at parenting interventions, and he specifically recommended The Incredible Years, which I had not heard of at that time. And just by luck, we had a psychologist in my department who was trained in The Incredible Years. And so we found an evidence-based solution that was community defined that we could use in this population. And so we were fortunate to get funding from our Clinical Translational Science Institute to do a pilot randomized control trial. And based on the community's feedback, they thought we should target Filipino families and partner with the Catholic Church to offer the program. And in order to decrease participation barriers, offer it in parallel to Sunday school. And so we were able to do the trial with 22 parents, and we were able to show that it was effective in promoting positive parenting practices, decreasing parenting stress, and improving child behavior. And although these results were promising, only about 20% of the parents that we outreached to agreed to participate. And so this moves on to the K23 funded study that we were able to get funded. It's focused on developing a theory-based video intervention based on the health belief model and theory of planned action. And in conjunction with a community advisory board of parents who just did that previous trial, these parents thought that I should make a video that had parent testimonials that talked about the benefits of doing The Incredible Years, and they thought it was important for me to speak about the Filipino health disparities that I had identified in my previous research. Of note, when I first partnered with the churches, they thought I should not mention those disparities at all. When I would go after Mass and talk about my study, they said, just stay positive. Just say, who wants to do a program to promote the academic and social success of your child, and not to mention any of the disparities that I felt ethically I should, but with this community engagement, I felt like I couldn't do that at that time. And so if we have time during the question and answer, I do have a 60-second clip of the video. And so the goal of this video was to really figure out, how do we promote participation in a non-research setting where we're not paying participants to do the program and not paying them to do the surveys? So our design was a randomized control trial. Our control video was a usual care video that's actually on the Incredible Years website. Parents were asked to do a 45-minute survey, and before and after watching one of these two videos, we had parents or grandparents of a child 6 to 12 years of age participate, and they had to be a resident of LA County. We did exclude children with developmental disabilities, but we did refer those children to Incredible Years in our mental health clinic if they were interested. In recruitment, I'll mention in the next slide, and then as our primary outcomes, we measured intention to enroll, but we also offered the program in the community and measured actual enrollment. We were able to recruit 215 parents and grandparents, and not surprisingly, the majority came from primary care clinics. And so just piggybacking on the last presentation, we did find that we got more receptivity when we partnered with Filipino pediatricians who had long histories in the community. We did get a fair amount from churches, and we basically went everywhere we could find Filipino families. Schools, not as successful, community-based organizations. We also went to grocery stores, health fairs, cultural festivals, as well as trying to do the website. And we recruited these families over a 17-month period with over 17 volunteer staff. This is our consort diagram, but I won't go over it in really a lot of detail, just to highlight that we did have to outreach to more than 600 parents to get the sample that we did obtain. So our first question was, did the video work? And the answer is yes. We did find that actual enrollment in the Incredible Years was 25% versus 11% in our control video, and this was a significant odds ratio of 2.67. And then our next question was, why did the video work? And so this was our logic. We thought that the intervention video would increase the perceived susceptibility of a parent in terms of whether or not their kid would participate in risky behavior, such as substance abuse, suicidal behavior, and teen pregnancy or risky sexual behavior. And we also thought the intervention video would increase their knowledge of Filipino-specific health disparities. And in turn, we thought susceptibility and knowledge would affect intention to enroll. And then based on the theory of planned action, we know that intention does correlate well with actual enrollment. And in fact, that's what we found. All of these associations were significant. And when we looked for evidence of statistical mediation, we found that the effect of the intervention on enrollment was fully mediated by increased knowledge regarding Filipino behavioral health disparities. So that, brought home to me that when you're a parent, and if you don't think that's going to happen to your child, you might not be as receptive to doing a parenting intervention. And so next steps that we're doing, we were fortunate to get funding from the Robert Wood Johnson Foundation, which is a leadership program trying to promote cross-disciplinary partnerships. And we are working on having a conference this July to start this community dialogue to promote healthy parenting. We're also doing focus groups, as Dr. Fishburne was talking about earlier, about creating a public shared vision. That's what we're trying to do, creating a shared vision of childhood mental health for the Filipino community. And we also have funding to develop a social media intervention among parents who enroll in the Incredible Years to try to promote social support and retention in the program. Now I'm going to switch gears. So now that I did 4 Incredible Years groups with the psychologists in the community, I became a real champion for the Incredible Years. And so I really thought, like, we need to bring this to my primary care clinic, which is a federally qualified health center in LA. And so I worked with Dr. Coffey, a senior psychologist who was a certified mentor in Incredible Years, and we tried to incorporate it into our clinic. Without grant funding. So starting with the background, we know it's very costly, mental health care. In 2015, hospitalizations for mental health conditions increased by 50% for 10 to 14-year-olds and 86% for 5 to 9-year-olds. There's high ED utilization for suicide and self-injury, as well as for behavioral disorders in children as young as 1 to 4. And we know that this is very costly, about $247 billion per year. And so the overall aim of this project is to really just describe the model of collaboration we use to incorporate the Incredible Years preschool parenting program in my primary care clinic at Children's LA. And we used a model of early intervention for parents of children ages 3 to 6. So basically, the way the pediatricians recruited families was to say this is a program for parents who just want to learn how to be the best parent they can be. It's a prevention program, and it's not for children necessarily specifically with behavioral disorders. And so we had to engage a lot of stakeholders. First of all, I became the pediatrician Incredible Years champion, and then Dr. Coffey was the psychologist champion. And together, we had multiple planning meetings with clinic administrators over an 8-month period. We wanted to identify all the relevant stakeholders and also just reduce barriers to collaboration. We had to develop a referral process with our social worker in our clinic so that she was on board. She also got trained in the program so that she could, understand what she was referring to. And then we had to get buy-in from the general pediatricians, the pediatric residents who are in our clinic, as well as our developmental behavioral pediatricians also working in our clinic. And we had a series of lectures about Incredible Years and lectures on how to even just use a lot of the principles in a typical well-child visit. And then finally, we needed to have a place and location for having the children in childcare while we were having the parent groups in the clinic. And so we partnered with our preschool that offers daycare for our employees. So 2 of my daughters went through this preschool. And we found that we did a Incredible Years short session training with the teachers, and they 100% of them attended, and a lot of these teachers were paid overtime to provide childcare. And this is just a list of some of the barriers that we were trying to overcome, and I'll just highlight a couple. First of all, we thought we would decrease stigma by offering it in a primary care setting. And then second, financially, we actually, I as a pediatrician saw the families before they started the program at week 1. And then I also saw them at week 18 after the program so that I could be the liaison between the primary care doctor and the psychologist as to what needs to be happening after the group ends. Like, do they still need services or are they good? And then we use LA County Department of Mental Health funds to fund the actual groups every week. We also provided childcare and dinner and some gift card incentives to overcome cost of parking. And so among the first 3 groups that we did, we had 41 referred, and so we had a 58% enrollment rate, again, which was higher than what I got in the community settings. And this is just our demographics of the participants. Of note, a lot of them did have diagnoses, even though we vouched it as a prevention program. And the mean number of sessions attended out of 18 were 12 and a half. And so I just wanted to end with a case. One of my patients, a 3-year-old Latino male, was referred to Incredible Years. And as you can see here on our measures, a lot of his measures on the ECB and pediatric symptom checklist were in the clinical range. And then after he did the program, he moved over to subclinical. Interestingly, we had talked earlier about health outcomes. His BMI actually went down, and we think it has to do a lot with kind of the positive parenting principles that the parents are using. And in the end, this family attended about 12 groups, and it really helped her understand her child's temperament and be able to just form a stronger attachment with him. And so in terms of future directions for this primary care integration, we were able to get funding to look at the impact of participation in Incredible Years on pediatric health service utilization. So we're going to look at ER and hospitalization costs as well as subspecialty referrals among the patients who participate in the program. We're also bringing people from Seattle from Incredible Years to get trained in a new universal version of the Incredible Years, which is 8 weeks long, and they're actually implementing that in Norway. And we're going to work with a Filipino primary care doctor to offer it to his families in his clinic, and also a Filipino cultural school this summer. And finally, there is an Incredible Years program that's developed for during well baby visits. So we're going to start brainstorming about how we can incorporate it more into well child visits. So in conclusion, increasing knowledge of adolescent risky behaviors can increase enrollment of parents in an evidence-based parenting intervention. And community engagement really is a critical tool to recruit these understudied populations, as well as figuring out how we implement these practices in real-world settings. And finally, we all know this, but the financial and administrative barriers really need to be overcome in order to fully integrate behavioral health services into pediatric primary care. There is a lot of people to thank, including my mentors and the NIH for their funding, and our community advisory board. And these are the people to thank for our primary care group. And I always have to thank my own children and my husband. I like to end with this quote: "Parenting is the closest thing we have to magic without doing magic." All right, and there's my email address. I'm happy to entertain any questions.